Hello! Today we are continuing our foray into the wonders of menopause. Today's edition is hot flashes. You can also think of them as power surges. These are horrible episodes that start in the chest or face area and then rapidly go to consume your whole body. Feels like you're going to burst into flames. Usually they last 2 to 4 minutes. In some women, they can happen once a day. Some women, they can happen once an hour. They can be a main contributor to sleeping problems, which then can lead to emotional problems, irritability, depression, and fatigue during menopause.
I may have been a little irrational today.
A little?
Shut up!
Many women experiencing hot flashes will have profuse sweating, and sometimes they'll even feel heart palpitations or like their heart is racing. They can really distract from whatever you're doing. They can cause cognitive impairment in the moment and can lead to anxiety attacks as well. Some women never experience hot flashes when they go through menopause. Congratulations. I wouldn't brag about it to your friends because they're not going to like you very much. For some women, they really are significantly impactful on their work or their social lives. They will even get to the point where they are not able to attend important functions just because they are either uncomfortable or embarrassed about sweating so frequently. For most women, hot flashes will last for 4 to 5 years max, but for some women, less than 10% usually, they can persist well into their 70s. And for these women, I just want to tell you, there are things that we can do for them. So stay tuned as we delve into what those options are.
Maybe now is a good time for me to explain a few things to you about menopause.
The most effective treatment for hot flashes is still hormone replacement therapy. And it's the choice for most doctors if it's appropriate for that patient. In women who have had breast cancer or other forms of cancer that may be estrogen mediated, it's not a good option. Also not a good option if you have a history of coronary artery disease, heart attacks, or strokes, or if you have a blood clotting disorder. Those can really increase your risk factors, and that's a discussion you certainly need to have with your doctor before choosing any of these medications. But for the women that they are appropriate for, using hormone replacement for 4 to 5 years can really significantly improve your quality of life. This is not a life or death issue, but quality of life does need to be considered. As far as which type of hormone replacement therapy to choose, that also is a discussion you need to have with your doctor, and I will delve into that. We're going to have a whole segment just on hormone replacement therapy. For women who would rather try other therapies first, or for whom hormone replacement therapy is not an option, we do have a lot of really good options. And in most cases, all we have to do is control these symptoms until you make it through menopause. So I have this discussion frequently with my patients, and we do have a lot of really good options. Number one that I turn to in my practice, and it usually works like a charm, is clonidine. It's an old blood pressure medicine that we don't use super often to control blood pressure, but if taken at bedtime, it can significantly improve your quality of sleep and decrease night sweats, and then can also work during the day to help control your hot flashes. Gabapentin and pregabalin both work through the nervous system to help control hot flashes and are a mainstay for a lot of doctors. SSRI antidepressants like fluoxetine, paroxetine, and others can be very effective. Also, venlafaxine or desvenlafaxine are also antidepressants that have really good literature behind them as far as helping with these symptoms. Also, I tend to pick those in women who are having depression or mood swings as part of their menopausal syndrome. Sometimes we can kill 2 birds with 1 stone. Oxybutynin is a medicine that is anticholinergic in nature. It's traditionally used for overactive bladder, but can be used to help mitigate some of these symptoms for some women. There is a brand new medicine called Veozza that works in the thermoregulatory center in the hypothalamus in your brain. So what it does is it goes in and essentially tells your brain, hey brain, it's okay, we don't need to have these wide temperature fluctuations, and can have some pretty significant results in a lot of people. There's another one being developed, so I think that this area actually shows quite a bit of promise when it comes to research and development. In some cases, women are prescribed progesterone alone, and that can sometimes be a great option for people. Some women go have cognitive behavioral therapy, or CBT. There are also other kinds of therapies that may or may not be useful, like acupuncture, stellate ganglion blockers. Some women will even use non-hormonal herbal or plant-based therapies like phytoestrogens or black cohosh. My caution with these is that if you have the risk factors we discussed earlier that may make you not good candidates for hormone replacement, plant estrogens are estrogens, so their safety has not been studied or established, and they have the same effects in your body that estrogen does, so they may not be the safest choice for you, but they may be a good option if you don't have high risk factors. There are plenty of over-the-counter supplements that you can try. I would just do those in concert with a recommendation from your doctor to make sure that you're not potentially damaging something else that could be going on. Some women report that they have improvement with hypnosis or mindfulness training. There's actually quite a bit of research that says that exercise, especially cardio exercise, can be very beneficial. And in some women, weight training can even be beneficial. We know that having muscle mass is good for your bones, so it certainly wouldn't do you any harm to try. Vitamin E is actually a pretty decent treatment for hot flashes alone, and so it wouldn't be a bad thing to try a vitamin E supplement before you talk to your doctor about other medications. Some have also reported improvements with either flaxseed oil or evening primrose oil. So those are other things that are available that you can try, and I'm sure there are plenty that I left off the list. Thank you, menopause brain fog. But we have a lot of options. It doesn't always have to be hormone replacement, but for those of you that it's an option, it can get you some pretty quick results. Stay tuned for more topics. Don't forget to like and subscribe.